mental pain is less dramatic than physical pain, but it is harder to bear. The frequent attempt to conceal mental pain increases the burden. It is easier to say I have a toothache than it is to say I have a heartbreak. Hi, my name is Blessing and welcome to Hug. Depression is a common and serious medical condition that negatively affects how you think, how you feel, and how you act. When people think about depression, they divide it into one of two things. Clinical depression, where treatment is required, and regular depression, where any one of us can go through. Depression is a concept that is hard to grasp, since it can be a symptom to a condition and a condition on itself. Today's episode will be divided into two segments. On the first segment with me will be a lady who's gone through depression and overcame it. On the second segment with me will be a pet therapist who will help us understand more about pet therapy. Hi, Gladys, welcome to the show.
Hi, Nassim. Thank you for having me.
You're welcome. So please tell us more about yourself.
So my name is Gladys Kuria. I'm a proud mother of two boys, a 5-year-old and a 4-month-old. I work in sales and marketing. That is my specialty. And so yeah, I'm here to share about my story and just my journey.
Please tell us about your journey through depression. How was it for you? When did it start? The whole show.
Okay. I would say my first experience where I started noticing something might not be okay was probably when I was pregnant with my first son. The circumstances around the whole pregnancy was not quite convenient, and I would say maybe it was hard for my mind to grasp the whole
transition.
Yes. So that moment, I remember one time I was having a conversation with my brother and my sister-in-law, and somewhere in that conversation, I just lost my mind and was jumping up and down, and I found myself after that I just shut down. I just shut down from your friends? Yes, from my friends, from my family, everyone. I just hid in my little corner. I think I was about 7 months pregnant at that time. So that was the first time when I noticed something like that.
You noticed something was not okay. And did you seek out help? Did you talk to your friends?
Not really. The thing with that is you don't want to come out as weak or a victim. And I find like that's something that I struggle a lot with. If you come out and actually tell people, hey, I'm not sleeping at night, hey, I can't stop crying, you sort of come out looking like a victim, and I don't look good as a victim.
And then another thing that I've come to realize is once you come out and tell people you're depressed, you're going through these things, the first thing people do is stigmatize you. They always relate to you, as that girl who's always, anakuwaga tu na maissues.
Exactly.
I don't feel like the society right now inachukulia depression as serious as it should be, because some people tell you sleep it off, go sleep, asubuhi you wake up feeling better, so I feel there's that that lack of knowledge around friends, whereby they don't know what to do or how to talk to,
and probably even myself, if I had not experienced it, maybe I would also be among the people who would be, sleep it off. But then having gone through it and knowing that sleep is actually the one thing I found hard to afford at the time, it's not the best advice to give something.
Okay. And when you're going through it, did you think it was, maybe kitu ya kawaida it will pass?
Yeah, of course, most definitely.
You thought it's kitu ya kawaida, it will come and pass, right?
Absolutely.
Then,
so after that, I didn't have another episode until after I got my son, of which now it was me and a crying baby in a room at night. And it was quite frustrating. So I grew up in a very loving home. My mom and dad were always there for us. I have 2 big bros, always have my back. And then I had a baby, and I was shut out from the rest of the world, and I was nursing and recovering from childbirth and all that. And so some of these things no one really prepares you for. No one prepares you for the paradigm shift of after you have a baby.
That transition period.
Yes, I moved from, there's a plot, I'm up, I'm going. There's an event, I'm up, I'm going. But now I have this baby, and if there's this little human being by my side who is actually fixing me here. And again, like I said, the condition around how I ended up pregnant with him, it was not easy. Yeah. So it became I started noticing this thing is quite serious, especially because of the thoughts that I was having in my head in the middle of the night when he's crying and I'm crying and we're both crying. And I think that was the first time when I figured this thing might not go away. It felt like quite permanent, to be honest.
It felt like, it's here to stay and it's something negative and everything. You said you had thoughts, right? Can you tell us more about your thoughts? Did you have maybe suicidal thoughts? Talk about it.
Yeah. Yes, I had suicidal thoughts. I remember I would sit in my room and we are both crying, and I'm looking around my room and wondering where would be a good spot to hang myself, because this is my life. Maybe it's not working out. And he's crying and I'm crying, and I would hear my mom go like, "Why are you crying? Everyone goes through this, But composing my thoughts, or like managing them, and
they were all over. They were
arranging them like this. It was very, very hard, very difficult.
I think another thing that most people don't realize is postpartum depression exists. It's real.
Yeah.
Most people don't know that people go through postpartum, especially new moms. You've never been a mom before. So the transition life for new moms becomes really hard for them, to grasp, and you don't know what to do. You just, you're freshly new into the whole thing. So I think people also need to learn more about postpartum, because I feel once you know what to expect, you'll have better understanding on when kwa hiyo sport saizo utajua nafaa kufanya hivi, I'm supposed to do this and this. You'll think to yourself, it's normal for me to experience all these feelings because I'm a new mom, I've never been through it before. So
young mom.
A young mom, exactly. And then it wouldn't be as scary as it is when you don't know what's going on. I feel it becomes
and
worse.
it's not a conversation that is happening.
Yes, that's the sad thing.
Because for one, childbirth is termed as a very normal event, and so secondly, women are termed to need to be strong. You have to be strong,
especially now that you have a kid. You have to be strong.
So to come out again and discuss, after having this baby, honestly, I'm not enjoying it. Honestly, I'm having a rough time. And with the kind of society that we are living in, it's not an easy conversation to have with anyone, or to even bring it up. Because I mean, for sure, I'm not going to talk with my mom. It's not a concept that she understands.
You're also scared of how she'd think of you, and the stigma that comes with it.
But she supported me totally. I mean, 300% throughout the whole season. It's just this kind of conversation.
You didn't know how to start the conversation with her. Let me ask you, what helped you get through it? Get through that period, that the suicidal thoughts. What helped you stay strong and, focus? Have a positive mind.
So, honestly, I can't pinpoint because I didn't do anything about it then.
You didn't do anything?
I didn't do anything.
You just
about
let it slide?
Then fast forward a couple of years later, This is in 2018 onto 2019, they're around. They started coming back. You know,
They started
thoughts,
recurring.
Yes, they started recurring. These thoughts started coming back, and episodes of being extremely, extremely, extremely sad. And 2019 was actually like the heaviest beat last year. Was the heaviest beat for me. Which there were thoughts, there were attempts, and up until now, around mid last year, that's when I thought, you know what?
It dawned on you like
Yeah,
you need
I
help.
need help. It's not good for me. It's not good for my child. At that time, I had only my firstborn. And I'm trying to be strong, but it's not working, you know. And the harder you try to be strong, the more you have those episodes, you really fall deep, you know. And I sought help for the first time last year. That's when I reached out to a therapist. Mid last year, after some of those episodes. Yeah.
And how did the therapy session go? Did therapy help you out at the time? How was the whole experience?
Honestly, I did just one session. I never went back after that.
Why? Why didn't you?
I felt this. Maybe I felt like there were dark things that were coming out that I was not comfortable
with. You were not ready for
I was not ready for that
whole realization and the whole conversation around it. The thing, let me cut you short, Kiasi. The thing with therapy is you need to be ready to go for therapy. You know, these things of people pushing you, but they end at therapy. If you go to therapy when you're not ready to, you know, go and fully therapy, you go and fully be naked, you know, to someone, and then another thing is laying out your problems to someone, to a stranger, is very hard.
It's very hard.
That's why you need to, you know, find a good therapist that you have a good rapport with, that, you know, a therapist that can see you through it, all of that. And then another thing that most people don't know is, with therapy, the first 2 weeks of therapy are very crucial, because the first 2 weeks are all about that creating rapport and coming up with a diagnosis, knowing what's bothering you, you know, digging deep into your life. And before now you get to the treatment plan and everything, the first 2 weeks of therapy are very, very crucial. So once you abscond the first 2 weeks, it becomes even harder for you to now, you know, start, because now you have to start all over again, get a new therapist, you know, and everything. It becomes even way harder. So I feel when you're ready to go for therapy, make sure the first 2 weeks you commit to it, like you stick to it, because it's hard, it's very hard, but at the same time it helps a lot, you know, because hapo hivyo sasa ndio unaanza kuchambua, you know, these are my triggers, you know, these are my issues and whatnot, and then from there you formulate a viable treatment plan for you that will help you later on in life. You've told me about, you know, the whole depression and everything. What would you tell someone who's gone through almost the same thing you've gone through? What would you tell them, you know, to do? Maybe something you didn't do then, like, did this open your eyes? Did you see things different? You know,
first thing I'd like to share is you're not weak. You're not weak. Just because you're going through a hard patch doesn't make you weak. Or just because you go through a couple of hard patches does not make you weak. It's life. When I look back, I didn't want to take control of my own mental health. I needed someone to change. I needed this circumstance to change.
You didn't look into yourself.
I needed my outside to change before I get better. Or rather, I needed to change for me to get better. Then you realize, you know, that strategy is not working.
You
it's
need to
not
start
working.
with you first before you starting with
Exactly. And I realized that
That
it's
is
up to me to take control of my mental health.
Mhm.
If I feel I have a, like you said, you have a toothache,
Mhm.
you do something about it.
Sure.
So if you feel like your state, your emotions,
You're
your
overwhelmed.
psychology, like it's just not working, like something is crashing inside you, attend to it, address it internally, sit with yourself, have a come to Jesus moment, and address it. Be naked with yourself before you can even be naked with anyone else.
Sure.
And to do that, something that I started doing recently, I write affirmations in
They go a long way.
so I took one of my son's old exercise book, and I started writing affirmations and sticking them on my wall all over my house. So since people spend so much time in the toilet, I have affirmations in the toilet.
Nice.
I spend time in the bedroom, I have affirmations in the bedroom. I have affirmations all over my house. Because sometimes these things don't come naturally to us. My mind doesn't naturally think the best.
You have not to recondition.
Exactly. So having to recondition my mind to thinking positive things and better things about myself, about my life, about my circumstances, helps me also see positivity in my life.
Sure.
And not feel so weighed down all the time.
And another thing that most people don't know is your mindset goes along with what you feed your mind. Most of the times, the issues you have are from negative thoughts. I walk around and then I see people laughing. The first thing I'll think is wameniona, wamefikiria niko hivi na hivi na hivi, so they're laughing at me. And that is not the case. So at the end of the day, I end up having a bad day because of something I thought that wasn't even really, true and everything. So I think it's time we also started changing our mindsets on things and started having positive minds.
Let me put a note there. My circumstances have not changed. If anything, they have come worse. But perspective.
How you view things.
Perspective. That is what will get you through it. If you're sleeping in a small house, it's you yourself who's telling yourself that you're sleeping in a small house.
True.
Or you're sleeping on a mattress and not a bed. It's yourself who will make it a good thing or a bad thing.
True.
It's me myself who will decide, is it a good thing or is it a bad thing? But so those affirmations tend to help me with the episodes. So not to have these consistent episodes where I'm breaking down because of the things happening around me. Like if you really just freak out and everything just spirals around, and it's hard for you to get yourself back to
on the ground.
Yeah.
I get you.
Exactly.
And then also feel like it's time people started, letting the past be the past and giving yourself time to heal, because I feel our generation right now, we are so entitled, to say so. So if something is not working out for me, I want it to work out for me right now, and sai like sina hiyo time ya let it grow yenyewe, like just give it time, yourself time.
And it's not easy. It's just letting go of the past, etc. It's not easy, especially when it's this past that has led you to where you are now. It's not an easy realization or an easy journey to take, but it's a worthy cause for yourself, for your family, for people you love, for your bright future. It's a worthy cause to take. Take that first step and just say, you know what, this is my journey. I own it. How it has panned out, it is mine. I love it. And I appreciate it. If it were not for this journey, I would not be here sitting with you.
So true.
If it were not for this journey, probably I would not even be having my 2 boys.
And you don't even know what the future holds for you and everything.
So I know it's not easy, but
it's something
that you have to consciously remind yourself. Like you have to capture your thoughts. Like you are going through this roller coaster and you're thinking, oh my god, my life is so worthless. You have to literally capture those thoughts and change those words. Literally change them. And creating a habit of doing it, it's gonna have a great impact on your life.
And
And I
huge,
believe so.
actually a very huge impact with
So-
it. So bottom line is have a positive mind.
Yeah.
Seek out
Work
help,
on it.
work on it, and then seek out,
Yes.
professional help.
Exactly.
Because I
Also,
feel,
to mention, I've started therapy recently because it's something that there's stuff that you probably need to dig through, as you say, triggers. These triggers that tend to make you spiral out. Those are the things that I'm trying to figure them out and how to manage them.
And how is therapy working out for you so far? Have you left this one too?
No.
So you plan on sticking
Just
on it
started.
and
I
commitment?
plan to stick to it. I know I'm going to have to face some
Dark
skeletons
past,
in the closet.
But that's just that's before you heal.
Yeah.
It's gonna be a rough road before you heal. But view it as hapo mwisho. The end
Yeah.
determines the means. So whatever happens in between therapy, just know at the end of it all, everything will have panned out perfectly and everything. And another thing, you can't make omelette without breaking some eggs, right?
Preach.
So whatever happens through therapy, just make sure you commit to it, stick through it, especially the first 2 weeks of therapy. They're very crucial to your healing process and everything. Otherwise, I really wish you all the best.
Thank you.
With whatever it is that you set out to do and everything, and don't be ghost to the guest.
Got
the
it.
show. Make sure you come back.
I will. Thank
Yeah.
you so much.
Thank you very much. So on our next segment, we'll be having a pet therapist. I don't know if most of you know about pet therapy. So he'll come tell us more about pet therapy. What is pet therapy? What's the difference between pet therapy and animal guides and so on? So stay tuned.